So Aaron DERFEL, who, of course, as you know, has been doing stellar work, not just on reporting the COVID pandemic and, of course, what happened at the Heron Nursing Home, with I guess it's fair to say, a blockbuster story today on what's happening at the MUHC, systemic racism at the MUHC, including chilling testimonials from some of the people directly affected. We want to get this story. Aaron is on the line. Aaron, thanks for taking the time this afternoon.
My pleasure.
Let's begin with where this comes from, because my understanding is this was a report commissioned by the MUHC itself. So how did we get to this?
Well, yeah, so it was nearly 2 years ago, you'll recall, following the choking death of George Floyd under the knee of a white police officer. There was this public reckoning to address systemic racism, and to the credit of the McGill University Health Center, it set up this anti-racism task force to carry out this, soul-searching exercise at the MUHC, a task force co-chaired by two women of color. And they proceeded, to carry out this exhaustive research, more than, I think it was in total, nearly 1,000 survey respondents, plus focus groups and 38 participants interviewed at length, up to 90 minutes each, everything transcribed, to get to the bottom of what's going on in terms of systemic racism. This is not to say that Quebec is worse than other provinces or that the MUHC is worse than other institutions, but rather that the MUHC is the first to carry out this examination of conscience.
So I'm trying to understand. They did this in the wake of the George Floyd case, not because someone had necessarily complained about racism being an issue there, just because they were looking internally to try to figure out what was going on. Is that right?
I'm sure that, as a matter of course, there are complaints made, but the real catalyst for this was the George Floyd tragedy. And then after that, we saw the death of Joyce Echaquan. So that whole initiative gained urgency. And the MUHC, it specializes in treating Aboriginal peoples in the far north of Quebec, as well as the Inuit. So, the MUHC realized that, in the 21st century, to move forward, it had to do this.
All right, and then the next question, and I'm just reading some of what you wrote here. This is a pretty damning statement. Systemic racism is a pervasive and long-standing problem in Quebec's largest hospital network. What did they discover here beyond just saying something like that?
Well, that nearly 56% of the respondents were somewhat to extremely concerned about racism. That visible minority participants did not have much confidence in MUHC leadership to make this institution a safer and more inclusive workplace, and that there were plenty of anecdotes where people who might have had the experience, but they might have been black-skinned or brown-skinned, that they were passed over for promotions. And there were cases of Islamophobia. One instance where a woman was wearing a hijab in an elevator and somebody yanked it off. A case where some patients don't want to be treated by a physician wearing a hijab. So it's not just an anti-Asian slurs. Workers overhearing. So plenty of anecdotes like that. Overhearing one nurse talking to another nurse and saying, "Open your eyes, don't be Chinese." I think, or a worker speaking to two racialized workers and saying, "Continue to work hard. You're our slaves." Something along those lines. So deeply offensive language, and backed up by the survey results and these focus groups. So the outcome of this, among the recommendations, would be to set up a safe reporting system to flag instances of racism, and then the appointment of a equity, diversity, and inclusion officer to implement the change. And that's a good thing, right? Because change is carried out at the institutional level, and the MUHC is the first out of the gate to do something like this.
And when we're talking, Aaron, about it being pervasive, as you just laid out there, it's clearly coming from the perspective of the employees towards patients and also from patients towards employees.
Yes, from both. And just another anecdote while I'm on the topic. One worker said, we don't know, they were called the N-word, and then struck repeatedly by a supervisor, and HR did nothing. We don't know when this happened, and I wasn't able to independently verify this allegation. But like when you read the report, which is nearly completed, it's so methodical and rigorous. That these people were interviewed at length. I don't think the others would have put this into the report had they any doubts about the veracity. And then there was another instance where a pregnant woman, Aboriginal woman, came in. She was in labor, and she was mistreated. She happened to be drunk. I'm sorry to say, but this worker who observed this said that she was given some substandard care. It echoed almost a Joyce Echaquan incident where, there were differences because the woman didn't die and this woman was drunk, but she was belittled and she wasn't given the care she should have been given. So when you amass all this, you as an institution say, well, we have to take steps to improve the situation. And Dr. Pierre Defeller, who is chief of the MUHC, the executive director, he said, we can and must do better. So this report will be submitted at the next board meeting of the MUHC on September 23rd, the completed version. And there's every indication that they will follow the recommendations.
When I hear you say every indication, I think back, we have a premier course that still at this point refuses to admit systemic racism even exists. And I'm kind of wondering what kind of an impact this will have at all.
Well, that's why I wrote a Twitter thread in both French and English. And, I mentioned the Echaquan incident. I mentioned at St. Eustache Hospital 2 years ago, I posted, these job openings, white only apply. And it's, the coroner, Jeanne Kamel, after her inquiry into the death of Echaquan, she urged the Legault government to acknowledge systemic racism. Legault has so far refused. So, in writing the story, the question could be asked, has he changed? Has he evolved in his thinking? Does he still feel this way in light of yet another report, acknowledging that there is systemic racism? Not to say, this is not a Quebec bashing exercise. It's not to say that it's necessarily worse in Quebec or it exists only in Quebec. The MUHC, its roots are Anglophone. The MUHC is acknowledging this. It's a bilingual institution, but it does raise the question in light of repeated denials by the premier. What does he think about this now?
Yeah, by the way, it's worth pointing out, this is not you kind of, discovering this on your own. This is a report they commissioned on their own. Mm-hmm. You just have access to it. It's already there. We know this actually happened. Exactly.
I because I have deep contacts and sources, I got an earlier version, and that sometimes happens. And, but I just felt that this was worth coverage. And just to sort of let you know, I've got a fairly dramatic story, a follow-up that's going in the Montreal Gazette tomorrow. And I can't tell any more than that, but just read the Gazette tomorrow.
So we should be booking you again tomorrow, in other words. But I found it kind of surprising, Aaron, that they don't already have at the MUHC an officer of equity, diversity, and inclusion. That seems like something that should have gone into effect a long time ago.
That's a great point, Natasha. The MUHC does have an ombudsperson, right? Mm-hmm. So to field complaints. But I think, a lot of organizations don't have them yet. I think that McGill only recently the university set something up. But, like McGill University, it's medical school. It's vaunted medical school. A few years ago, it was put on probation by the certification bodies because, among other reasons, it lacked some understanding in terms of sensitivity towards students who of Indigenous origin or black students. So it's this reckoning that's happening, and for the longest time, the focus has been justifiably, I believe, on law enforcement. Have police officers, sometimes police officers will stop a black person, sometimes for no reason. Then but now, it's a reflection of our society that it's moving just beyond law enforcement and looking in the health sector field. And I think that's a positive thing.
I just wonder, beyond the 5 hospitals that make up the MUHC, what about other hospitals in the province? Does this give them the impetus to do the same thing and have an officer responsible for this, do you think? Or does this get bigger than just this story?
That's my purpose in writing it too, and then writing that Twitter bigger threat. Will these other institutions follow the steps of the MUHC? Will they, become enlightened to do something like that, to show the institutional courage to do this? I know it reflects well on La Presse and I believe Radio-Canada that they have reported on instances of what many would consider to be systemic racism at other institutions like that hospital in Saint-Eustache. And there was also a black patient who died under very questionable circumstances at Charlemagne Hospital on the South Shore. This issue is not going away. The media are on top of it, and at least the McGill University Health Center, to its credit, is taking steps to address it.
Aaron, again, congratulations on a great story and great work on this one. And thanks so much for joining us. Appreciate it.
My pleasure.
Aaron DERFEL of the Montreal Gazette.